My name is Dr. Sarah Jarvis. I'm a GP and Women's Health spokesperson for the Royal College of GPs, and I work at Richford Medical Practice in West London. Thrush is a yeast or a fungal infection. The most common kind of thrush that we think about is vaginal thrush, which is the kind that ladies get inside their vaginas. However, it is also possible to get thrush, the same yeast infection, inside your mouth, or in men you can get thrush, usually on the nether regions. Other kinds of fungal infection which affect the skin include, say, athlete's foot and jock itch or thrush, which affects the skin in areas which tend to rub together, such as between the groins or possibly underneath the breasts, in the folds of the skin. The most common cause of thrush that we think about, perhaps vaginal thrush, tends to cause soreness, irritation, and possibly a sort of slightly cottage cheesy, whitish, creamish, very itchy discharge from the vagina. In the mouth, it can cause soreness with white patches, which if you scrape them off, leave a little red patch underneath. That tends to be both sore and itchy. And in men, the same thing, white patches on the skin, which if you scrape them off, leave a little red patch underneath. They are sore and itchy. There are several treatments for thrush. Most of the treatments that we use are what are called topical treatments. So, for instance, a cream on the skin, or a pessary and a cream, which can be inserted into the vagina, or sometimes an oral gel or oral tablets, which can be sucked, or an oral liquid, which can be slooshed around the mouth. Yeast loves to grow anywhere that's warm and moist. That means that if you have any bits of your skin, and especially the vagina for ladies, which are very warm and moist, then thrush will often thrive there. For women, if you change the normal germs, the normal friendly bacteria that live in your system, you can be more prone to thrush. And that means that some women find they're more prone to thrush when they've taken a course of antibiotics. Thrush in babies' mouths is not uncommon. It's absolutely nothing to worry about, although it can be distressing for them and it can have some problems with their feeding. If you're bottle feeding, it's very important, obviously, to sterilise all bottles, but it's also important to sterilise dummies which are being used and not to suck them off to clean them and then pop them back into your baby's mouths, as unfortunately we're all perhaps a little bit tempted to do. It can be easily prevented, easily treated by using a gel which can just be wiped onto the mouth, and it is important to check with your doctor that it is thrush rather than simply milk curds, which can be easily wiped away and which are often mistaken for oral thrush. It may be that if you're breastfeeding, you have thrush around your nipples, and it may be worth checking to see if the skin of your nipples needs treating in order to prevent you from passing thrush on to the baby. You can buy pessaries and indeed oral treatment for vaginal thrush from your pharmacist without a prescription. It is very important to be aware that you've got thrush rather than anything else. If you've had thrush before, you'll often recognise the symptoms. However, it is important to make sure that you don't have another sexually transmitted infection. So if you haven't had thrush before, or if the symptoms are at all different to any other thrush symptoms you've had previously, it is very important to seek medical advice and get tested for sexually transmitted infections. Oral thrush, thrush on the skin, and vaginal thrush can all be treated with the pharmacist giving you something over the counter.
For more information, visit www.nhs.uk.